Welcome to the DaVinci Hour podcast. I'm your host, Dr. Maxwell Cooper, and in this podcast series, I interview physicians, medical innovators, and entrepreneurs making an impact on healthcare. This podcast is produced by DaVinci Academy, a multimedia medical education company that provides podcasts, video courses, and digital textbooks. You can see more on our website, www.dviacademy.com, and our YouTube channel, youtube.com/c/DaVinci Academy Med. This podcast is sponsored by Doc2Doc, the personal lending platform designed for doctors by doctors. Do you have some big expenses in the near future? Maybe you're moving, applying to residency or fellowship, fixing up your car or home, or starting a new practice. Doc2Doc believes that traditional lenders overestimate the risk of lending money to doctors, residents, and medical students, focusing too much on the challenges of their financial past and giving them insufficient credit for the promise of their financial future. Check out Doc2Doc's personal loan options at doc2doclending.com/DaVinci. Hey everybody, welcome back to the DaVinci Hour podcast. I'm honored this week to be joined by Amir Bozorgzadeh, co-founder and CEO of a new startup called Virtuleap that's working in the virtual reality space and, with a number of different applications. Really excited to hear more about it and some of the neuroscience behind it. So Amir, thank you so much for joining us. Really appreciate it.
Thank you. I'm super excited to be on the podcast with you, Max.
Awesome. So maybe give us a little bit of background, about, where you went to school, what you did before, co-founding this company, and then, eventually how that kind of led into where you are right now.
Sure. So I grew up in Canada, but been an expat in the Middle East and Europe for about 17 years. Market researcher, games publisher, did a couple of stints of social impact oriented startups. Then I had an itch to get into the virtual reality sector. And I started that quest by writing for a few years for VentureBeat and TechCrunch, really just scouring through all the different applications, trying to figure out where this technology really fit in, and at the same time become a quasi expert of some, generalist sort, figuring out that the critical applications really are in two categories, education and healthcare. And in 2018, I co-founded Virtuleap with my longtime business partner, Hossein Jalali.
That's awesome. And are you guys headquartered in Spain? I know you're located in Spain, but is that where you guys are headquarters, or are you kind of more beyond that even?
So the parent company is actually a Delaware C Corp.
Oh, okay.
But because investment for such a crazy moonshot sort of sector, in my opinion, the U.S. market is pretty much the mecca for that kind of funding. So you have to have a U.S. entity at the end of the day. But our headquarters has always been in Lisbon, Portugal.
Oh, wow. Okay.
And recently we're opening up the office in Spain, here in Barcelona, simply because we need a wider reach for talent, in particular, neuroscientists, machine learning experts, game developers. There's a much bigger pool of experienced people here in Spain, but not too far away from the headquarters.
Awesome. I guess what's the overarching view of the technology you guys are developing? And then I guess what was the initial inspiration to start this company? What kind of problems were you hoping to tackle with this?
Well, starting backwards, I've always had phobias of vertigo and spiders, and specifically when you're in Europe and international, you're going on planes a lot. It's not a very nice feature to carry with you, so to speak. And I began in around 2013, 2014, investigating using VR for my own fear of heights. And through exposure therapy, I found that it wasn't not only just effective, but even at that time, with the headsets being, the VR devices being somewhat, compared to today, which is not that long ago, but it's like quantum years compared to 2013, 10 years ago. The devices even then were so effective for these types of healthcare oriented applications. And it was very effective for me. And that was my particular, the calling of the hero on his quest. The remainder of what I needed in terms of ingredients to get me to really launch a company was all the lessons I learned as someone covering this space as a writer.
Very interesting. Yeah, I mean, that's interesting how you kind of you began with your own kind of your phobias, and I can relate. I'm afraid of heights as well. I always get kind of anxious a little bit on planes still. But yeah, and it's interesting with the, using it for exposure therapy. So I know you guys are using it to like help obviously do kind of like a cognitive workout, if you will, and kind of build memory and cognition and things like that. So I guess maybe go through that part, like the educational and like that aspect of it, which like how does like what's the user experience like for that?
So like virtual reality for me, I'm not a fan for any use case that deals with escapism and fun stuff. I guess I'm really boring there. I really like the real world. And when I see VR coming in and having a critical application, not a nice to have one, is when it helps you transcend some kind of restriction in your life. And that's education and healthcare, like I mentioned, but also experiences that are about maximum 20 minutes. I think there's a lot of things that have to do with VR that haven't been researched to the top level to my satisfaction in terms of what happens when you're there long enough, and that really relates to why it's so special in the first place. It is literally the first embodied digital format. So your autonomic nervous system, when you show your visual sense a different reality, it's like we're tricked into believe we're not designed to live in two realities at the same time. And so the visual sense is tricked. It literally hijacks the autonomic nervous system. The vestibular balance system will be wobbly and like shaking your legs. If like you and me have any sense of phobia of heights, then our knees will buckle and shake. So like why? Because those nonverbal circuitries are believing it's actually real. That means like the applications for like PTSD, exposure therapy, cognitive behavioral modification, when you're head to toe engaged, how can you compare that to a screen-based device? Ultimately, just tapping and typing with your fingers on a screen. When you use this technology on older adults, like even 80-plus-year-olds, we just did a pilot with even 90-year-olds in Kyoto, Japan, specifically for novelty, bringing VR solutions in that kind of longevity sector. And they don't need so much onboarding, like they need to learn the UX of this, application. No, you pick up a cup of water the same way you do in real life, because it's an imitation of the real world, and that relates to why VR is ecologically valid. That's why it's multi-sensory. That's why the data will be better quality because of the engagement, the adherence levels in every of the 5,000 plus studies worldwide. Always adherence levels are higher. Retention levels are always higher. And then I think what's key about our company is we're really, I think, the only company at this stage, at least, who have created data infrastructure that's about capturing the psychosomatic data. You're not just collecting the psychometric data from the content, but also we're capturing the postural data, the gesticulation of the arms. We're collecting even physiological sensors like heart rate variability and pupil dilation tracking. We have an AI learning algorithm that takes those biosensors and calculates your cognitive load, knowing if you're focused or not. So in a marketing company world, that's scary stuff, right? Double-edged sword. But for studying ADHD, for understanding the process of Alzheimer's, using our solution for those applications, it's just profound openings of opportunities that no 2D device could ever match.
Yeah, that's really interesting. I'm wondering from the neuroscience standpoint, has there been any studies on, do they see kind of greater, or I guess longer lasting memory or longer lasting, I guess learned abilities through this more immersive virtual reality than, like you said, using like a 2D screen or just an interactive device?
There's a lot of range of different studies that are focused in a specific area, and they can show a particular kind of our own ADHD study that we just published last Friday. It shows that our tool in an initial pilot study, only 1 month long, focused on university students with attention deficit, it significantly increased processing speed. It's an indication like that. We're so early in the stages that we have indications like that all over the place. With the FDA and in the US market, what's really become mainstream is using VR for pain management. That's one of the main flagship use cases. You'll see companies like Applied VR and Behave VR, US companies being the leaders globally for that. That's one of those areas where they were so well tested and it's already approved. it in fact falls under a whole new category the FDA created a few years ago called medical extended reality. And so, yes, the answer is yes. There's studies here, but we're not at the conclusive edge of saying on a podcast like here that it's clear cut, agreed by everyone. But we're getting there, and I think COVID really greased the wheels in making things so much more streamlined, and the most stubborn stakeholders in those bureaucratic systems much more open to accelerating the roadmaps for emerging technologies.
That's really interesting. One thing you hit on there. So the FDA has a new class for this. You wouldn't have to go through the approval process, like, for, a medical device or something like that, or does it kind of fall under the umbrella of a medical device? I'm curious how that works out.
It falls under the umbrella, but it's got its own jargon now as well. So it's
Oh,
not just considered a digital therapeutic wrapped along the lines of 2D. It will be classified and understood as a breakthrough technology that is seen in its own right for certain applications that now has initial precedence that other companies can kind of fall into and have a proper code for reimbursement, and all those things are just happening as we're talking. So I think the big challenge moving forward is not so much the regulatory bodies, especially the FDA, because that's the market I look at always first and foremost, but the doctors, the neurologists. Those are the choke points now to really get them on board in mass.
yeah, it's interesting you bring that up. So, as you know very well, that medicine is often slow to change or slow to adopt, new, especially something as innovative as VR. I'm curious, what's some of the kind of pushback maybe or skepticism you've received, and I guess how have you guys overcome that? I imagine part of it's the data you guys have generated, but I'm curious, what your strategy's been with that.
You see a lot of the hesitation in some use cases in which I think perhaps VR is not the best solution necessarily, because of the inconvenience of the technology in terms of maybe having to resource for the hardware on top of what you already have, or perhaps not enough of these studies have made those people yet comfortable, because you got a gazillion of the studies of tried and true technologies, and then you're asking for them to relearn new areas where they're going to see holes in the research. So it's not ironclad yet. You have things like that. They'll, if someone doesn't want to use a new technology or learn about a new technology, or for change, innovate. If they don't want to innovate in that particular comfortable way of doing things, their usual protocol, then they can find any reason, right? The pushbacks can be, it's just like in our sector of or any sector in technology world, startup world. When a VC doesn't want to fund you, they'll find an endless amount of reasons to it. So I think case by case, it's really just about the neurology community, for example, in our case, not seeing, let's say, a wave of these studies one by one coming in with those success stories yet. It's happening. It's like literally that FDA category for medical extended reality was just 3 years ago. It's super fast. So every day things are moving in that direction. But if people are not wanting to do it, then you have to kind of somehow, or unfortunately, wait for the next generation of those doctors, those neurologists, some of the people who are more on the fringes. They have to be your early adopters, and then it kind of, comes in from the edges.
Yeah, definitely. No, that makes sense. I mean, there's some people you're never going to convince them, like you were saying, whether it's a physician, an investor, and so on. But those innovative minds out there, I think if you show them enough convincing, which it sounds like you guys have, you can definitely get them on board. I think that's pretty cool.
And I have one other thing to say. The hardware iteration for VR is just so fast. It's like 3-4 years ago, the headsets were completely different. I'll tell you one aspect of that. Before, the most popular headsets were actually what we call 3 degrees of freedom, which means the content wasn't syncing with your body movement. So like you can go on a roller coaster experience, but your body is not interacting with it. It's not, there's no external sensors. And that caused a lot of unfortunate incidents of nausea. Because if you're going down, you're falling somewhere, but your body has no haptic relationship to that experience, because we're so intertwined. Our the way we're connected we can detect the most subtle of an error between what should happen in that circumstance of an environment shifting in that way. And then now there is no headsets like that at all. They're all 6 degrees of freedom. If I lean, the content leans. There's a complete connection, like in the way of simulating reality properly. And so the nausea is just so hard to hear of now. But those people, those individuals, it's only 3-4 years ago. It's like in a blink of an eye. COVID was like, what? When did that happen and go, right? So they still remember that bad experience with some of these other headsets, and things have just rapidly iterated so fast. So that's also one problem I keep going across. I keep hearing complaints about something that to me, VR is like doggy years. So I'm like, no, well, that was ages ago, but no, it was just a couple of years ago. So, it's challenging when this kind of technology iterates so fast that people don't realize they don't need 10 more years. Every next technology, like AI, for example, within 5 months, there can be rapid shifting of the land beneath us.
That's really cool. I'm curious what you think about this, but I feel like VR in a way a few years ago was maybe ahead of its time a little bit. It was kind of this cool, innovative thing, but people didn't really know what to do with it or what to. And it sounds like, especially from what you're talking about, that has rapidly changed, and now it's, those avenues are becoming much more clear.
One, and I did write for a while about VR and some of these major blogs, but one thing I noticed, and I've been trying to make a new affirmation lately to not be so negative about certain topics, but the media are one hell of a thing in terms of when they want something to happen. They just, I don't know, if there's like some kind of groupthink phenomenon. When I was in the early days of this company, 2018, 2019, at that point, they were like the media and the people who do like the market forecast, they were like, VR is the next gaming machine, and that's all it is. They didn't make any mentions of the use cases for serious applications. In the meantime, very quietly, the hospital, the clinicians, the academic workers were doing it because it takes time. You don't do shortcuts with science, and they were working hard on those areas, or just being ignored altogether because they don't have an agency, a PR agency on standby to just keep on communicating, blasting in the perfect way that journalists see it. But journalists were like, gaming, 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 gaming. And then it wasn't hitting the forecast of 100 million users in like 1 year. Oh, big surprise. So they go, VR is dead, 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 dead. I mean, it's really a hard ecosystem when a lot of buzzwords, like you're hearing the metaverse, you're seeing Web3, so much crypto before. I'm glad I'm not hearing so much about NFTs now. It's just, they love buzzwords and they love the pendulum swing. They don't like middle ground. They love like death and non-death glory. I don't know. It's just like, it's so, when you're trying to be sober and try to do good in this sector, it can somehow be a little bit less edgy. And I think the media was somewhat and is always having a big influence on that.
Yeah, definitely. I agree with you 100% on that. I think it's what's hot, what can sell the most headlines, all that kind of stuff. And I think that's an interesting point. I'm curious, from going in back to the science a little bit on the like this recent study you guys did with ADHD patients. What's like walk us through like the study design. Like, how do you actually demonstrate this really works? Like, do you have 2 arms, like one patients that use a more traditional therapies and then ones that are using yours? And I guess how do you demonstrate, like what kind of metrics are you using to demonstrate that?
And I should have had my neuroscientist on this call. The thing about it, it's like a really short 1 month study. It's got a sample of 25 students. It was actually run with partners of ours in Portugal. Porto ran it, and the whole thing was recruiting a sample of students, university students with ADHD, playing about 6 games only of our 15 exercises versus a control group of people who aren't necessarily diagnosed with attention deficit. And so the type to, maybe the way we were using certain tests, like, traditionally like the MOCA or something like that as the way to validate it, it would be the way we did it this time. But it was really about just showing that clear indicator that, that this is what I sometimes like to call like the Ferrari of those digital therapeutics. You'll see companies like Achille Interactive in Boston, Lumo Labs with Lumosity also moving into therapeutics. A lot of people now that in fact the Achille, I'm not sure if you know, but Achille has this game called Endeavor RX, which was during COVID the first game that can be prescribed as a medicine for pediatrics for kids with ADHD, 8 to 12 years old. And that was the first time. It paved the way. It was the first time a doctor can now prescribe a game instead of some drug or something more invasive. And so this pilot study was really just to, shot across the bow to say, if that's the therapeutic of choice, a game, then you might as well use the most best of class format for such a game mechanism.
I think that's really cool. The use of games in this, I think, like you said, getting people to not only, one of the biggest issues is patient adherence, people staying with, either taking their meds or, continuing to go to therapy in the case of, mental illness or those types of things. So I'm curious, is that, using the games, obviously that probably makes it more fun and interactive. Is that part of the strategy is also to like help people be more adherent to it long term?
There's been a lot of tradition in this as well, because one of the things in terms of the brain training sector, which we kind of relate to, it's all about a specific type of design called closed loop design. And so basically it's like really the games we create are pretty analogous to going to a gym, normal gym outside, and you have some machines for the back and triceps, some for the chest and biceps, some also for the lower body, the legs. People can pick and choose as they will, and the 15 exercises we've created are like that. And they're also closed loop design, which means you pick the weight level, but of course in a digital experience it kind of just plateaus at your weight level, and then you go back. Just like in the real world, you usually start off where you left off and you try to go a little bit higher. And that's the part of the gamification of it. And we call it games, but in fact, they're not so fun, and they're not designed to be addictive. Although, we always have some people who can love anything a little too much. The games that touch on your cognitive strength, because everyone's got some cognitive strengths, some have cognitive weaknesses. The ones that are touching on your weakness, typically you hate those games. You never want to play those games. This is always the truth. For example, we have categories like spatial orientation, right? That's another thing that you can't have in a screen-based device. And I really do not like spatial orientation games. I don't like spatial audio games because these are areas where I'm weak on. And in real life, you'll see I'm getting lost in these European towns. My wife goes, really just shocks her. How can I just not know where north is? But you can see it in the data, and you don't like those games. You try to gamify just enough that the things that you don't want to play are fun enough, but every game is maximum 3 minutes long. So it's also very short.
That's awesome. Yeah, I think, making it enough where it plays to your strengths, but also, helps you, build on those weaknesses. Like you said, kind of like you do at the gym, you continue, you lift, X amount of pounds one week, and then you hope to graduate to the next. I think that's pretty cool. I'm curious, how are you guys, is this software, or is the device part of your guys' offering, or is it more like people can use your offering on any device? I guess maybe walk us through, and then if they're like handheld parts of it as well.
So we are software only, but we support all of the major headsets. We're agnostic to all of the ones that are popular. The Meta Quest 2, the Pico 4. I'm just using jargon here, but these are there's only three main players in the space. It's Meta, Pico, and HTC, and we support their flagship devices. We have about 50, with no marketing, by the way. We have 52,000 early registered users across 5 languages, including Spanish, English, Japanese, and these are somewhat reflective of the VR sector, because it's an early adopters. So you have a lot. I think 85+% are of US, of usage, and they all require at the moment both controllers. However, I think within the next 6 months, especially up to the next device that Meta is going to be releasing, I think we're going to start moving into an alternative of no remotes, and actually just hand participation, which is going to be a really nice movement. One thing to note is that also we're experimenting to move some of our games from VR only to mixed reality. So your environment is still around because the next generation of headsets you're going to see in the market are going to have dual functionality of VR and mixed reality, or some people would call it augmented reality still.
That's really cool. That's really cool stuff. So I guess, how does the business model work? Is it if it, I guess if it's more just a consumer like trying to, use it to build their cognitive skills, is it like a subscription model? And then I guess from the patient side, and you're probably still working out the specifics of that, but I guess how is it, something like their insurance gets billed for, or their, whoever, if they're in a single payer, country, like, that gets covered under that, I guess, how does that all work?
Yeah, so we have this enterprise platform, or data portal that all of our research partners currently use for the most part. So MIT, Roche on the pharma side, UCLA, a variety of different partners, mostly between Europe and the US. They'll license that tool, and the whole business model that we're looking to slowly implement, because up till now we've only been really monetizing based on a per case pilot. Kind of every pilot's a little bit different. Now we're looking into more of a SaaS model where you charge based on the number of users some company wants to use, or some research entity wants to use. We're going to be introducing that by Q3 this year. At the moment, we don't have a standard model. It's really, if there's ever a clinical group or researchers that want to work with us, we've never said no because of money. It's just unfathomable to say no to anyone who wants to work with us on the research side, although we'll try our best, serving as a small startup. And then, when it comes to how at the end of the path, like a patient would actually reimburse, we have there's one CPT code that opened up in the US just in January, specific to cognitive assessment in this area. We could easily fall under there, and we're working to do that. So it's really what you're saying is right now that's really in motion. I think only probably 5% of the VR healthcare companies out there are even yet attached to a CPT code, or they're all working on it now because it's just opened up, and specifically ones for VR.
That's really cool. Yeah, I think that the way that plays out is going to be really interesting, how the whole reimbursement, obviously the FDA has gotten on board with this, relatively rapidly, probably not as rapidly as you wanted to, but has gotten on board to, have its own classification. And then I imagine, if the FDA gets on board, the payers will hopefully soon follow suit with that. I think that's pretty cool. I'm curious, where are you guys at in terms of like, involving like clinicians involved? I guess like, obviously you probably have like a advisory board or things like that, or physicians you consult with. I guess how has that perspective helped you guys with the development of this, having that clinical perspective?
Yeah, so everything on our side is initially developed, and quite the product owner really is a neuroscientist, and that neuroscientist designs the path and then collaborates with a game development team. But during that path, even from the articulation of what to create, then going into prototyping, and every one of those stages, we are always more or less working side by side with one of our scientific advisors. For example, Walter Greenleaf at Stanford VR, or Albert Skip Rizzo at UCLA. Both gentlemen have been doing VR healthcare for groups like the VA since literally the 90s. So, they do tolerability tests initially. We want to make sure we design games so they adapt, whether you're sitting and mobility restricted or standing, all in place. Do you have color blindness? We have settings for that. Do you want to change the font size? We have settings for that. Everything is accessibility first in this whole process. But like you say, it's always also in close correspondence to groups like the Pacific Brain Health Center, and a variety of these people who've actually, I don't want to say it's sad, but it's weird in a way, because VR has actually been around in multiple loops for quite some time. And when they look at what we're doing in 2023, it's kind of sometimes like a Groundhog Day situation, where right now, knock on wood, is the time where ultimately the technology is sleek and sexy enough, light enough, fast enough, cordless enough. All these things have just kind of gone to the next level, but they have seen those iterations, those initial attempts. They've seen the wrongs. They can see it a mile away what you're doing, because they've been through 3 other iterations.
That's really interesting. Yeah, and it's interesting you mentioned how your one collaborator is working with the has worked with the VA for a long time, because I imagine that
Sure.
would the veterans, as you probably are aware, there's obviously high incidence of PTSD and other mental illness and mental health issues that they have to deal with given their unique experiences. So I would imagine VR would have tons of applications in that regard, and also a population that could probably really benefit from it as well.
Yeah, well, the VA has been really innovative and really fast acting to work with VR companies. They just made a big partnership with that pain management solution by Applied VR that I mentioned to you. They were the first one that the FDA, gave that status, and now they have a partnership with the VA, working closely with them. And we, for our part, are working closely with the VA healthcare system in San Francisco, particularly through the CSF addiction research group. So they're all about addiction and how addiction causes through PTSD as kind of like the macro causation. Addiction causes an acceleration of cognitive deterioration, and that's the angle we're going. We just are submitting another grant application with them right now. We work with an amazing individual who's been even trying to use VR before we ever were around in this area of cognitive training and so on, David Pennington from their addiction research program. But we've been more or less courting them for about 4 years. So we also know along with them, even when you want to work inside the VA, and I've learned so much, it is in fact the biggest healthcare system in the whole world. And no one really knows that from the outside, but it's a jungle. If you're outside, forget about it. You need to understand the insides and then work with the champions that you do. But it's looking really great, and that partnership that I just mentioned, it only happened about, or at least it was announced 2 months ago.
That's amazing. That's amazing. It's interesting you bring up addiction medicine as well, because I would think VR would have a lot of applications for that. Potentially. I'm curious. How do you see that working in? Do you guys have any of your exercises or games that kind of you're developing or have currently available for that aspect as well?
Well, it's funny because we actually with David created a prototype of a different product. We call it codename Volition, and it is basically a cognitive behavioral modification exercise specific to alcohol abuse. So it's really about gamifying an experience of good choices and bad choices and a scoreboard and other factors like bringing the noise around a bar, a bartender talking to you, things that can trigger you. So you really try to create an environment with a simplified game mechanism, but you focused on all of the environmental triggers that can serve as cues to get you, in the wrong, following the wrong habitual frame of mind that gets you falling back into it, rather than trying to create and build up those new kind of that bridge into positive behavior. So we created it, and it's actually a pretty polished MVP or pilot prototype, but we haven't actually mentioned it. In fact, you're the first person who just suddenly.
That's awesome. Yeah, no, I imagine that's something, because that's something people, as struggle with for, a long time. Some people struggle their whole lives with it, unfortunately. And so
Yeah.
I think, and there's not, obviously there, AA and other programs like that have, been great and been very helpful. But I think, this is a space where I think there's room for definitely improved, therapies. And I think, from what you're describing, that's an amazing application for VR and an opportunity. Yeah.
Yeah. Well, so Albert Skip Rizzo of UCLA, PTSD, VR simulations, creating it for the VA in particular. Why is that great? Because again, you can go and create exposure therapy environments where you literally recreate the full kind of environment of that initial trauma and try to build up. You can, make it more intense, less intense, completely controlled environment. So when you have that controlled environment, when you have it so rich in terms of triggering you from multiple angles, but being able to control each of those angles in customized ways, VR is a godsend for these types, I think, of treatments. And more or less, hopefully one day, something that not necessarily only has to be applied as a prescribable solution, but something that we provide tools to create those strong neural pathways simply available to anybody. And, I don't think we're that far away from that.
That's really cool. I'm curious from like just the standard like cognition standpoint, like how, what kind of data have you guys seen with like, someone's being able to, remember, five items versus, 100 or something like that. And I realize I'm probably being facetious there, but I guess what type of like how good can we actually get potentially? Because you always hear people, neuroscientists say we only use, what I think
Right.
it's like 10% of our brain or something like that. I'm curious, from like the cognitive, improvement standpoint, where you guys at with that?
Well, see, my point of view, in fact, and I think nothing on our side has really shown anything to contradict this. When we talk about whether playing our games can actually, the holy grail is called far transfer. It's whether playing these games will help me better remember my grocery list or do my, calculations in my head faster and all these types of things. And to my experience so far, talking about, what we've done and our research and the broader research out there, I'm pretty convinced that there is no such thing as far transfer beyond a certain level for a generally healthy individual in terms of their optimum. If you're sleeping well, have a good social life, the most key thing I think is regular exercise. All these kind of things that are tried and true. I think our great grandparents could have told us these things, right? Get some fresh air, yeah, as much as possible, fresh sunlight, all these things. Eat fruits, eat a Mediterranean diet. I mean, it's just so common sense. I think if you do that, you are functioning at a pretty optimum level for you. Where I think it's a therapeutic is when you are experiencing cognitive deficit due to lack of sleep, due to depression, any mental health disorder, addiction, lifestyle factors, or a disorder like ADHD, or you're one of the 70% of people who when being treated by chemotherapy, you have chemo brain, or whatever percent, I think I might forget what percentage are getting long COVID. Anything that's memory fog related, that's kind of like a condition, a circumstance, traumatic brain injury recovery, rehabilitation. I am very convinced in terms of the literature that that's where we serve as a therapeutic. But unfortunately, I have to say to all those people, I was one of them like 20 years ago playing these brain training apps, thinking it's going to give me the edge. I don't think that's the way. I think where it can give us the edge, hopefully, is becoming stronger where we're weak, because we just avoid those weaknesses. We glorify our strengths. And I think that's not actually a weakness necessarily that needs to be as weak as that. It could be a little bit higher if we just didn't want to avoid our Achilles heel.
That's yeah, that's really interesting. It's there's no I guess there's no magic pill after all. um
Unfortunately, not.
yeah, yeah. I'm curious from your guys' stage, I guess, where are you at in terms of like funding and those types of things, and like where you're at in the development process, and like where are you hoping to go in the next 12 months per se?
Yeah, it's a hard one to be honest. The US market has been such a big part of everything we've focused on, and currently there's a sort of fear among investors, the fears of a recession in general. There's so much, just like the media flocking in one way. When there's any blood sniffed out by any of these different groups that ultimately startups are relying on, it happens in mass. And there's a lot of VR healthcare companies that are suffering at the moment. We're having to rejig and create a whole new commercialization strategy. We've raised about 1.5 million to date, and we've been looking to figure out the right way to approach our next round. But at the moment, we're focusing more on commercialization, selling our product as it is, because it's on the market. There is organic demand. There are clinics and groups that are interested in it. And that's our focus, as well as grant partnerships. People who are on this, listening to your podcast, any clinicians, academics, we love relationships with those groups where we can go and apply for federal grants and private grants to fund the research, because ultimately that's what the most important part for us is.
Yeah, that's really cool. And in many ways, grant funding for many reasons is often the best funding. So yeah, I think that's a really cool and strategy you guys are working on with really being a research driven, a data driven company, and then obviously having grant funding to help you guys do that. I guess as we close out here, I ask everybody, when you're not building this VR company, what do you do in your spare time? How do you find that balance, if there is one?
Well, one thing that's great about being in Europe, uh, what's not good is being a startup in Europe with a mentality from the US and Canada. Okay. Like I think I'm not very popular out here in terms of, certain American philosophies that are just built into me in terms of, how we approach running a startup. Over here, it's much more employee centric, right? You can't really let go of people so easily in systems that are a little bit much more leaning, not a little bit, much more leaning on the socialism side. So working in business, there's a lot of cons, but what is certainly a pro is an endless thing, things to do in terms of hiking for my part, going to theaters, not cinemas, but like actual live theaters. A lot of the things that in Europe are, the arts, being able to travel and get lost in very, very windy towns where my spatial orientation skills literally do get me lost. There's a lot of novelty being in this region.
Yeah, no, that's really cool. I'm sure there's a plethora of things to do. That's awesome. Yeah, you made an interesting point there about the difference in the startup environment in the U.S. versus Europe. I'm curious, is that do you see things changing in that regard? It seems, are there more startups popping up in the European space? I guess for the American listeners out there that are maybe curious about how things look in that realm.
See, like I didn't I say in the beginning of the startup, or maybe I didn't, that I want to be nice. I don't want to say negative things. I just, it depends. If it's like a certain stage where they're already making good money, these kind of things, it's a different situation. But when you're an early stage startup, I really do think the investors in Europe are very risk averse. The startups here are based on that culture. It's really hard to pivot because of employment rights and all these types of things. The only exception is the UK, and funny enough, they left Europe technically. So it's the UK is the only exception. You'll find that the northern startup scene perform better than the southern ones. I think there's a lot more propaganda by the startup groups out here. I think you have to be very careful for early stage kind of investments out here across the Atlantic. I think personally, if you're going to invest in this part of the world, then I would focus first and foremost in the UK, where the legal writing is in English.
It's really interesting to watch that too. Amir, thank you so much for taking time out of your busy schedule to be with us. I guess the last thing is, where can people learn more about Virtuleap and what you guys are working on? If they want to get involved and collaborate, what are the best ways for people to do that?
Like, I am a hardcore user of LinkedIn, so please add me on LinkedIn, Amir Bozorgzadeh. You can email me at Amir, AMIR, at virtuleap.com. Virtuleap.com. Our website is really comprehensive at this moment in terms of outlining in pretty good detail all of the games, the science behind them, the enterprise tools. But please feel free to reach out to me directly.
Awesome. Well, thank you, Amir, so much. We really appreciate it.
Thank you so much for the opportunity.
Thank you for listening to this episode of the DaVinci Hour podcast, presented by DaVinci Academy. Please be sure to subscribe to our YouTube channel and follow the podcast on your podcast platform of choice to catch the latest episodes. Please leave a comment or a review and share it with a friend. Lastly, you can find all of our podcasts, video courses, and books on our website, dviacademy.com. Thank you for listening.